Broadcasting all over the world at urbanbroadcastmedia.com, delivering love and inspiration 24/7. This is UBM Praise. The following show is paid programming and does not necessarily express the views and opinions of Urban Broadcast Media and its subsidiaries. Thank you for listening to UBM Praise.
UBM Praise proudly presents Warriors Talk.
You have just tuned in to Warriors Talk with your host, Lady Rochelle. Warriors Talk is a platform to address how cancer, as well as other diseases, are running rampant throughout our country, and how we can move away from awareness to taking action. Warriors Talk will empower listeners by keeping them informed, connected to services, and encourage them to thrive while surviving.
I'm a survivor. I'm not gonna give up. I'm not gonna stop. I'm gonna work harder. I'm a survivor. I'm gonna make it. I'm a survivor. Keep on surviving. I'm a survivor. I'm not gonna give up. I'm not gonna stop. I'm gonna work harder. I'm a survivor. I'm gonna make it. I'm a survivor. Keep on surviving.
Welcome to Warriors Talk. I am your host, Lady Rochelle, and I'm excited you have chosen to tune in today. It is Testimonial Tuesday, and I am inviting everyone to join me on all forms of social media. Facebook /Warriors Talk with an S, Twitter @Warriors Talk 1, Instagram Warriors Talk 1, Periscope @Lady Rochelle. For a rebroadcast of the show, you can go to Spreaker.com, and that's Spreaker.com. Make sure you follow me, and I will follow you back. You can also call in at 773-675-5906, and we would love to hear from you. And this show is actually dedicated to 3 warriors that lost their battle with cancer last week. David Bowie, Alan Rickman, and Renee, who is Celine Dion's husband. And Leah Steele, who is now cancer-free. She is the daughter of the NFL pro football player, Devon Steele. Warriors, please keep her in your prayers. Last week on the show, we talked to Pastor Phyllis Harrell, and she came and shared her cancer journey. She faced adversity, won with faith in God. With God in her corner, she didn't stand a chance. She took cancer down with her knowledge, a will to live, a positive attitude, with a loving support system that kept her motivated. She is an advocate when it comes to getting the facts about your health, eating healthy, staying active, and eliminating stress. She pointed out how she is no longer existing but living. She left Warriors with some very important takeaways, but the one that stuck out the most is God is a healer. And in the news, we found out that President Obama, in his final State of the Union address, he actually said that Joe Biden would spearhead an initiative to cure cancer. He said that Joe Biden said that with a new moonshot, Americans can cure cancer. Obama said, before noting that Biden had worked with Congress and added resources from the National Institute of Health, he announced that a national effort to get it done, because he has gone to the Met for all of us before on many issues over his last 40 years. So he's putting Joe in charge of mission control. For the love of our loved ones that we already lost, for the families that we can still save. Let's make America the country that cures cancer for once and for all. And it was also reported that Joe Biden met with the American Association of Cancer Research last week to discuss short-term goals that are obtainable while he is still in office. And we know that some of this is not going to be possible in the near future, but it is likely that it will be achieved within the 1 year. So therefore, Biden's team has immediately came up with some small initiatives that they can do. One of them is including a data sharing program that focuses on tumors and how tumors respond to various treatments. So their researchers are going to be sharing data across institutions. And substantial financial investments by the federal government for gene sequencing. which might yield advancement in personal treatment for cancer. Now, this is very inspiring, and I know it gives a lot of us hope that are still fighting. So good luck to Biden. And we are going to our healing scripture of the day, which is Jeremiah 32:27, and this is the New Living Translation. I am the Lord, the God of all the people of the world. Is there anything too hard for me? God loves us and he sees our situation. Whenever we doubt God's wisdom and we wonder if it's practical to keep obeying him, we can review when we are ready to know about him. Such thoughts and prayers will quiet our doubts and calm our fears. And I am so excited today. We have someone in the room with us who's going to share some information that's going to be life-saving. She was born and raised in Chicago. She completed her bachelor's degree, a bachelor's of science at Benedictine University in Lyles, Illinois. She earned her master's in science and nursing, her nursing degree from Loyola University in Chicago. She is a family nurse practitioner, board certified by the American Nurses Credentialing Center, and she's licensed by the state of Illinois to provide primary health care to patients of all ages. She currently resides in and serves people in the Proviso Township area. She has a passion for disease prevention and health promotion, and she primarily works with minorities, uninsured, and underinsured patients. Welcome to Warriors Talk, Whitney Henderson.
Hi, thank you for having me.
Welcome. I'm so excited that you're here because I know the information that you're going to share is going to be life-changing for the listeners.
Yes, I just like to say I work primarily with adolescents as well as people of all ages. Full-time, I work in a school-based self-centered Proviso East High School in Maywood, and I also work for PCC Community Wellness Center in Oak Park. Prior to this, I've been a nurse for 10 years, working inpatient, mainly at Loyola in Maywood, so I've seen how cancer can affect families from early diagnosis as a family practice provider as well as in the hospital as a staff nurse to where, you know, it's critical and they've had surgery or need surgery or are undergoing chemo. So I definitely know how it affects people and families.
Wow, and it's very important to have someone that understands what you're going through. A lot of times people give you advice and they have not walked in your shoes. So for you to be there firsthand to see what the families go through from beginning to end, you know, that's amazing. And I just want to commend you because it takes a certain type of person to do that type of job. And mentally, you know, what's going on in your mind mentally when you see this going around you all the time. So I commend you for that.
Thank you. I commend you as well, being a survivor.
Thank you very much. Cancer is actually the second leading cause of death in the United States. About 1/2 of all men and 1/3 of all women in the United States will develop cancer during their lifetime. Today, millions of people are living with cancer or have had cancer. 1 in 8 women will develop breast cancer in their lifetime. 4,000 men, women, and children will be diagnosed with cancer every day in the U.S. When cancer is detected early, the survival rate for breast cancer is greater than 92%. And we're going to listen to a clip. It's about African American women and breast cancer. In the clip, it's going to point out about African Americans being silent about their diagnosis, and also how the death sentence for women with African American women is like 17% lower than white, and the mortality rate is 34% higher, I should say. Although white women have a higher incidence of breast cancer, for some reason our mortality rate is higher. So women, it's important. This show is very important. Make sure you're taking notes and that you're taking action after that.
Scientists have known that African American women die more often from breast cancer than white women. Scientists thought the difference might be due to unequal access to health care.
But as News Channel 5's Kelly Dunn reports, a recent study found it isn't a lack of insurance or socioeconomic differences causing more African American women to die.
Several years ago, when former County Commissioner Addie Green was diagnosed with breast cancer, she initially kept it quiet, but eventually it came out.
It ended up on newspapers, television, radio, CNN. I had people who were serving the legislature with me calling me.
But now Addie believes that not talking about the disease may actually be harmful.
When they hear of they call it the C word, cancer, they really think that that's a death sentence. And I think we need to make sure that our women of color are being tested early.
The statistics are shocking. The 5-year survival rate for white women who have had breast cancer is 95%, compared to 63% for African Americans.
The fact that our incidence is 17% lower than, non-Hispanic whites, but our mortality is 34% higher. So that really struck me.
Scientists suspect that the more aggressive cancer, known as triple-negative cancer, may be the problem.
With the new breast cancers that were being diagnosed, that 16% of those new cancers were this triple-negative in non-Hispanic whites versus 82% in African Americans.
Dr. Randall and Addie Green both have the same advice for African American women.
You got to go and have a mammogram.
Kelly Dunn, WPTV News Channel 5.
And for more information, contact the Susan G. Komen For the Cure helpline at 561-514-3020.
Whitney, African American women and breast cancer. What's really going on? Break it down for me.
There are many reasons why we are dying at higher rates than our counterparts. It is due to lack of insurance or underinsurance. Now it's a little bit easier with Obamacare, especially with preventative health services to get screenings. A lot of the time we don't make time to get screenings out of fear.
Yes.
A lot of times when you mention cancer or anything negative, it's kind of speaking it into existence culturally, and we're doing the opposite of what we really need to be doing as far as getting it addressed, getting screenings. You have a car, you get it maintained.
Yes.
You go for oil changes, you go to have your tires rotated, you have to have your windshield wipers changed, tires changed out in the wintertime, but we don't do the same thing with our bodies. We're smoking, our diets are bad, we're not exercising as we should, and all of these contribute to higher rates of cancer. In addition to we're black, we have higher rates of heart disease,
everything,
higher rates of literally everything, and it shouldn't be this way. We need to empower ourselves and take action to take care of ourselves.
Yes. I like that word, empower ourselves. I like that you used that analysis about the car. You're right. I think sometimes we take better care of our car than we do ourselves.
We do.
We do.
And how we look, we get our hair done, we get our nails done, we go shopping, we look good.
Yes.
We don't get checked up, we don't go for our screenings. I have a mother, I'm pressing her to go for her colonoscopy, for colon cancer screening. She keeps saying she doesn't want to do it.
Do you think it's the fear of the unknown? Like, I think some people would rather not know than know.
It is the fear of the unknown. We have a lot of support, we have faith, but a lot of times it's easier for some to just kind of not know what's going on, that they don't want to even speak it into existence or to even think that this could be a possibility. We go into denial a lot of the time. We may even find out information and, we sit on and we don't tell our spouses, we don't tell our children, our loved ones. We just kind of keep it inside and it eats at us.
And I've always pushed that your support system around you is very important. So if you're keeping this information to yourself, you don't have a release. You know, you have nobody where you can bounce information off of or go to the doctor with you just in case you miss something,
Right,
you
exactly.
know, because in your head, all you hear is cancer. And then they may be telling you some important information, but you can't hear any of that
Right.
because you're focusing on the cancer. So I think it's important to not keep this diagnosis to yourself. And also, the screenings, I mean, they tell us what to do every